Hi, I'm Dr. Jason Siegel, and this is Neuro Now. On November 20th, 2006, former Philadelphia Eagles defensive back Andre Waters was found in his Florida home. He had shot himself in the head. On February 17th, 2011, former Chicago Bears defensive back David Duerson shot himself in the chest, and the next year, on May 12th, 2012, former NFL linebacker Junior Seau was found dead, also with a self-inflicted gunshot wound to the chest. And on April 17th, 2017, at approximately 3 o'clock in the morning, former University of Florida and New England Patriot tight end Aaron Hernandez was found hanging from a bedsheet in his prison cell. What did all of these tragic cases have in common? They were all young, healthy men. They all died by their own hand. None of them were over the age of 50. And they all had signs in their brain of CTE, Chronic Traumatic Encephalopathy. CTE is a neurodegenerative disorder, kind of like Alzheimer's or other types of dementia. Patients with CTE don't develop their symptoms right away, and like those other types of dementias, usually emerge years and sometimes decades after the injury or injuries. You might be asking, so how do we know these players don't have Alzheimer's? Maybe playing football has nothing to do with it. That's where the unique pathological markers come in. Whereas some symptoms might be similar to other types of dementia, the brains have a very specific pattern of injury that is unlike any other neurodegenerative disease. People with CTE have accumulation of a protein called phosphorylated tau in brain cells, but the location is quite interesting. Phosphorylated tau accumulates around blood vessels and in the deep valleys of the brain called sulci. If you think about it, this makes sense. If you get repeated head injuries, the blood vessels can jostle within the brain, and when the ridges or gyri of the brain compress and release, the deep grooves act as hinges, causing more injury there. As we'll discuss, the symptoms are variable and overlap other neurodegenerative diseases, so a clinical diagnosis is still elusive. The only way to diagnose CTE is to combine the symptoms with looking at the brain under a microscope after somebody has passed away. A lot of work is being done to identify biomarkers in the blood and cerebrospinal fluid and on brain imaging like MRIs and PET scans, but these are still in experimental phases. So, who can get CTE? Well, as the name implies, CTE occurs in people with repetitive head injuries, both concussive and subconcussive. As you can imagine, this does include many former amateur and professional athletes, but also members of our armed forces. The exact prevalence and incidence of CTE is not known. It's true that upwards of 90% of brains donated to CTE brain banks do show signs of CTE, but you must remember that this is a self-selecting group of people. These are former players or family members of former players who feel that they have signs and symptoms of CTE, so the rates of positive findings in those brains are probably higher than in the general population and in the population of former athletes. There are no studies that create a direct link between the frequency, severity, and total exposure of head injuries with the risk of developing CTE. There does seem to be some underlying and currently unknown genetic risk factor that makes some people predisposed to developing it. And as far as scientists know, you cannot get CTE from a single concussion or a single traumatic brain injury. There does seem to be the importance of a repetitive injury to the brain. It is also important to mention that the repetitive injury does not have to be concussive. It can be subconcussive. That is, repetitive head injuries that don't actually cause any symptoms at the time of injury. These types of repetitive subconcussive injuries are also tied to developing CTE. What are the symptoms? CTE symptoms are variable, but usually involve a constellation of behavior, mood, and cognitive changes, as well as possible motor deficits. About 43% of patients will actually present with a mood or behavior change. The most commonly seen symptoms are memory impairment, executive dysfunction, attention and concentration difficulties, sadness, depression, and hopelessness, each of these occurring in about 2/3 of patients with CTE. Patients often recognize that they are not themselves. This can lead to further depression, substance abuse, failed relationships, bankruptcy, and in about 30% of cases, suicidal ideation or attempts. Even though there are no specific clinical or diagnostic tests for CTE, it's still important that you see a neurologist to rule out any other diseases that might mimic CTE that may be curable. I also want to make the distinction between CTE and post-concussion syndrome. These are not the same diseases. They are very different in both their clinical presentation and their pathology. And as far as we know, most patients with post-concussion syndrome will not develop CTE. Are there any treatments? Unfortunately, there is no cure or FDA-approved treatment for CTE. Management is centered around symptom management. SSRIs are prescribed for depression and anxiety symptoms. Acetylcholinesterase inhibitors are prescribed for memory difficulties like they are with Alzheimer's. But like Alzheimer's and other dementias, these medications don't do anything to stop the progression of the disease. Cognitive behavioral therapy and psychotherapy can also be very helpful for mood and behavior issues. CTE is unique among the neurodegenerative disorders because there is an exquisite relationship between a human behavior and developing the disease. Yes, there are many human behaviors that could be risk factors for Alzheimer's. And no, we don't know exactly how many hits to the head it's going to take for any individual to get CTE. But more than any of the other diseases, CTE has a much stronger cause and effect relationship. And that's scary. And the headlines are tragic. And we feel guilt because our kids are out in the field. And we feel guilt because we cheered when that free safety laid out the wide receiver. Sports are ubiquitous in this country. We play them for entertainment, for physical health, to learn the values of hard work and teamwork. We join the military out of a sense of duty and purpose to serve our country. And then we see these young, healthy people succumb to a disease that takes their mind from them. And that is very unfair. It's scary to face a disease that makes us feel sad or guilty or that's unjust. But if we want to prevent future headlines, we must learn more about CTE. We cannot ignore it because it's scary. The science of CTE is rapidly expanding, and I hope that in this video you learned a little bit more about the disease, but there's still a whole lot we need to know. Why do some people get it and some don't? Is there a way to diagnose it before a person actually dies? Is there a way to cure it? And maybe most importantly, is there a way to prevent it? If you would like to learn more about CTE, find CTE support groups or patient resources, or become an advocate for CTE awareness, I recommend going to concussionfoundation.org/CTE-resources and ctehope.com. And I'll have links to these websites in the description below. As always, thank you so much for watching. Please share, like, and subscribe these videos. Visit us on Instagram, Twitter, and Facebook. Leave questions and comments in the comment section below. I'll get to them as fast as I can. I'll leave links to the references and resources I use in the description. Thank you so much again for watching, and I'll see you next time.